Hey everyone, I'm Kim Shiffman, Editor-in-Chief of Today's Parent, and we're here today for a Facebook Live all about fertility. So I'm really excited to be able to help you guys with your questions about fertility, which you can submit in the comments. But first, let's start with introductions. So I want to start by introducing Dr. Marjorie Dixon. She is CEO and Medical Director of Inova Fertility, which is a full-service fertility center. And if she looks familiar, it's because she's on City Line a lot answering questions about fertility. We also have Natalie Preddie here. She is a travel blogger and a content creator, and she might also look familiar because Natalie was part of a video and content series called This Is My Journey, which you might have seen around on Facebook, and that was all an opportunity for women to share their pregnancy and fertility journeys. As we know, it's a very unique journey for every woman, and so we're excited to have both of you here today. Before we go any further, I want to thank our sponsor, which is First Response. First Response has a host of products for women who are looking to conceive, for women who are pregnant, and you'll learn a little bit more about those products later. I do want you to stick around and make sure to ask some questions in the comments, and maybe even share your fertility journey, because we will be selecting a winner to get a beautiful prize pack full of First Response products and also a $100 gift card from Shoppers Drug Mart. So definitely get the comment section all filled up with all your questions. It's a pretty great opportunity to have an expert here to be able to answer anything you wanted to know about fertility. So let's get into this. The decision to start or grow a family, it's a unique journey for every woman. And there can be some unknowns, some confusing parts. You're not sure where to go for information, so this is where you can go. Start asking your questions in the comments, but while we're waiting, I'm going to have Natalie start by telling us a little bit about her journey, and we can get the conversation going.
Oh, wow. So about 4 months ago, I had my second son, and it was a very different experience than the first. So with the first son, I was diagnosed with PCOS, which was a terrifying diagnosis. I didn't know what it meant. I didn't know where to go. I should have found you.
I'd have been happy to help.
Yes. Well, later I found out, after trying and getting an ovulation kit and seeing if I could predict the days and everything, I found out that I didn't actually have PCOS, and it was a misdiagnosis. And I actually just wasn't ovulating. Yeah. So this was something, a entirely new revelation to try to figure out, okay, well, what now? So I started on a drug called Femera.
Yeah,
is that right?
Yeah.
Femera?
It's an aromatase inhibitor. It helps you to ovulate when you don't ovulate. Yeah.
Well, I began to ovulate. So then I was able to figure out which were my, the days that I was ovulating, that I was most fertile. And we went on a journey, and did all the fun stuff, and eventually, we ended up getting pregnant with my first son. But it was really scary because I didn't know. When I thought I had PCOS, I didn't know what that meant. I didn't know how that was going to affect me trying to conceive. I didn't know if I was going to be able to have kids. And I felt like I didn't really, have the information or know where to go. I was looking on Google, and, that can be a bit of a rabbit hole to go down.
No, diving deep into a rabbit hole, that can be.
Yeah, it was scary.
Yeah, and when I validate what you say about being given a diagnosis of PCOS and not really knowing what to do with it, but the main thing is that we as specialists have done a really good job of teaching people how not to get pregnant, like contraceptive.
Right.
But we don't do a very good job at all of teaching people how to get pregnant. So when women are starting to have an idea that they want to start a family and they don't know where to go or who to turn to, and you don't necessarily need a doctor at the beginning of the journey, and this is what we need to do a better job of teaching parents. What can you do at home to figure out when your most fertile time of the month is? So there are kind of the subjective things that people look for. So if people are having regular cycles, which is a bit different than what you were doing, but when people are having regular cycles, the average cycle is 28 to 32 days. People look for, the mucus. So sometimes people talk about having this
egg white.
Egg white mucus. I don't know who decided that was a cool thing. Oh yeah, that's like egg white. Anyhow, the loose mucus, or thinking the time of the month where women are feeling a little bit more like, oh yeah, I'm interested in sex now. That's because your estrogen goes higher and you're about to ovulate.
Yep.
Those are subjective signs, but not everybody has them. If you're looking for something objective to do, one of the things you can do is use a urinary, so checking your urine, and a urinary ovulation predictor kit.
And so that's what I used as well. I remember on my honeymoon, I had one in the bathroom, and I would do it every day for about 10 days, I think it is, and trying to figure it out. Now, of course, I wasn't ovulating at that point.
Exactly.
So it was
the quality of an ovulation predictor kit and its ability to predict your ovulation is only as good as, well, if the person is really ovulating, the person, and then how you're taking the test, and then how good the test is. So tests nowadays can be 99% effective in knowing when ovulation is happening by looking at this hormone called LH, if you actually manage to test baseline. So in a cycle, before a woman ovulates, there's a hormone called LH. That's the ovulation hormone. So it comes out in the bloodstream. Doctors can test in the blood, but it gets excreted in the urine, so it comes out in your pee. And you have to know what your baseline is in order for the test to be able to predict when there's a surge. So you have to actually start taking the test on day 5 of your cycle early on.
Yes.
Most kits have like 30 tests in a cycle because women's first half of their cycle can vary. So you have to do it first thing in the morning. You want to do also 2 hours without voiding. So 2 hours without urination, so your urine is concentrated. Not drinking for 2 hours. So if you get up and you have a big giant drink and then you pee,
it's going to be very diluted.
Exactly. So you want to follow the specific instructions on the package that explain to you how to put the test together, how to seal the test strips, because sometimes if the test strips are not good, you can't use a group of test strips the subsequent month. They're good for 1 month. You read the instructions on your machine. You can actually pee onto the test strip, or you can dip it in a cup, in the urine cup. So you have to read the instructions on how to do it. You have to know about the conditions it needs to be done in. You have to also know, are you on any medications that might confound the test? So that's another thing. And actually, with PCOS, if you have a high baseline LH, you might not be able to test the kit. So the fact that the kit worked for you is pretty much an indication that you didn't have PCOS. You were just not ovulating.
Yes.
Right?
Yeah.
So these are all things that are really important for people. And then when you see the surge happen, that's when you know it's time to get busy.
Time.
It's time.
It's time.
So it sounds like the test does have to be used in a very specific way, but it's not difficult to use.
No, I mean, I never used it, but I did do some testing of it because I knew we were going to be talking about ovulation predictor kits. So I have used it recently, even though I'm not trying to conceive. Just
Let's make that clear.
But yeah, so it's a little, when you're peeing onto it, so you can do it, I'm being full disclosure, you have to kind of aim and you have to hold it in your urine stream, which can be tricky. So I found it easier to actually collect into a little cup and then to dip it. And then that way you can be very specific about laying the test out on the table. You also, in the test that I was using, there's a little clock that appears. And then you have to know that, okay, the test is ready to use. Then you actually dip it in the urine, you hold it there for the 15 seconds, you put it on the table, you don't touch it. It says don't tip it upside down. You have to read the instructions.
Absolutely.
Because those will confound the reading of it. Okay. And then you do it at the same time every day, and it's simple. It'll say no, 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 yes.
Okay. So while you're taking this test, you're trying to figure out when is the best time to have sex. But shouldn't you also be preparing your body for pregnancy at the same time? And what are some of the best ways to do that?
100%. So again, it takes time to see a specialist. So I say there are certain things that you can do at home when you're anticipating pregnancy. One is things around health. So we know, for example, taking prenatal vitamins, women need folic acid because of the risk of what we call neural tube defects, so open spine defects in babies. We know that if women are taking prenatal vitamins containing 1 milligram of folic acid 6 weeks before conception time, it significantly decreases the occurrence of these neural tube defects. So actually the recommendation by our governing bodies, the obstetrics and the College of Obstetrics and Gynecology, is that women be on these prenatal vitamins for 6 weeks before.
And that's what I did as well. And I noticed now there are gummies, which is amazing because taking that big horse pill.
That's what I call it too.
The horse pill every day. It can be a lot. And this would have been a lot friendlier. But yeah, I did that as soon as we thought about conceiving,
That's good.
we started taking the prenatal vitamin, and actually I still take it now as I'm breastfeeding.
Actually, you should. So it's good to have it as well, the iron and the calcium, because you're growing a skeleton when you're having a baby.
Yes.
And then also there's obligate anemia that happens because your blood volume doubles to triples in pregnancy, so the cells have more fluid and therefore you're anemic. So it's important to have the supplementation of the iron too, so that's a good point.
Yeah.
Okay, so you're taking your ovulation test every day, and you try to get pregnant on the day it says yes. You're taking your prenatals, everything's cool, and then there's that 2-week wait.
Yeah.
Which is really hard for women to wait to take the test, because once you've decided you want to get pregnant, you want to get pregnant.
Yeah.
So I'm curious, how soon is too soon to take the test? And were you one of those women who was like, well, it's probably too soon, but I can't help myself?
Oh, absolutely.
Yeah.
With my first son, I took it like 3 times before I should have. Every month I was like, oh, it's that time. Okay, it's probably too early, but just in case, And I was going through the tests like mad. And I was actually writing a story for the Toronto Star I was in Belize on a trip. And I thought, gosh, I don't feel well. It's like I have seasickness, but but I don't. But this isn't right. And I also didn't want a drink, which was mad. We had this delicious fresh rum with fresh coconut, and I was like, I don't want that. Something's not right. So I got home and I said to my husband, I think I might be pregnant. He goes, okay, you know what? Let's calm down. We'll wait till the morning. Let's not get too excited. So I laid there until I could go to the store and get a whole bunch of pregnancy tests. And thought, we don't know how many days or anything like that, but just bought about 7 of them, I think, and peed on them and just, had them all laying out. And then I saw the little pink lines come up, and
you kept doing them?
And I kept doing. I had to be sure. I had to be sure. But then with my second, we went through the same process, and again had to take the Femera to ovulate. And we were on a cruise, and we were in day 1 of the cruise, and I had that same feeling. I thought, I don't feel well. So we stopped off at the first port, and I went and got a pregnancy test. And I bought the drinks package for nothing. But it was, just seeing those, and that was a lot sooner than we anticipated. I mean, it took months. Well, actually, from start to finish with my first, it took years. So when we anticipated that sort of length with the second, and then a month in.
Good job.
Yeah, good job.
Well
done.
Did you use the LH kit that time?
I didn't actually that time, but because I thought, I'll do it next month, and and I was doing blood tests to complement it as well, and ultrasound.
All right. So
back and forth. I was being monitored, and I thought, okay, I'll do it to next month to make sure that I can see it at home as well as the doctor doing it. But then those little pink lines came right away a month in, and
was that at the time of your first missed period? Like it was a, do you know? Yeah, exactly.
Well. See, again, I didn't really know, because even with the Femera, it would be like 28 days, but then the next month would be 32.
30, a little bit longer. It can vary.
So it varied a little bit, so I wasn't 100% sure, but, I bought the test anyway.
And it worked. But the 2-week wait people tell you the 2-week wait is the worst part of anything. And so most of the time when patients in my clinic, they come for a blood test, I'm like, did you cheat? And they'll like, oh yeah. So they tell you. But the good thing about tests now, I mean, my last test I took was 2009. It was on the inauguration of Obama's day, January 20th, and it was positive, just saying. But I remember, and I was in Washington D.C. We all were traveling when it happened. Yeah. So, but when you now can do the tests, you can do them up to 6 days sooner. Right? So if of all women that are pregnant, if you're taking all of 100 women, 76% of them, or 76 of them, will be pregnant if they're taking it 6 days early. But then if they're taking it within 3 days, it's 99% effective now. Same thing, it's a hormone, it's called HCG, human chorionic gonadotropin. It comes from the placenta, or the embedding pregnancy into the uterus, and it goes into the bloodstream, but it's excreted in the urine. So then you can actually, again, take your urine and use the test. Now, the issue is, again, that the quality of the test is only as good as the person taking it, following the instructions of the test, because they are 99% effective if you follow the instructions, right? So it has to be concentrated urine, your first urine of the day. You don't want to have just drunk 2 liters of whatever when you woke up. And then you also want to make sure that you follow the instructions on it, because there's a line that says the test is completed, and then there's the pregnancy test line. And so it's very important. I find patients are taking them sooner and sooner and finding it does get darker the more concentrated HCG there is in the urine. So the first day, even if it's the faintest, that's a positive test. That's the other thing that people aren't sure.
Yeah.
If it's a faint first line on it, if it's positive, it is.
Right.
Yeah.
And we're not really worried about false positives. If you see that line.
If you say, well, there are sometimes though, so if you are taking medications for fertility, sometimes that can confound a test. Okay. So if you do have a positive test, I encourage people to, 48 hours or even 24 hours later, do it again. Right. Just to be sure.
Buy 7 and do them all.
Then you can feel pretty good.
Exactly.
Yeah. Then you can be really, 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 really sure.
Yeah. I feel like most women are not buying one test. I mean, you're buying a few tests. You want to be sure. Exciting news. We do have a question from someone watching, and please keep the questions coming. You have access to one of the best fertility doctors in the country, so it kind of makes sense. All right, so we have someone who's saying, I've been trying to conceive for 2 years. This person says that they've tried Femara and Clomid. And are there other things that she and her husband should be doing other than taking multivitamins?
Okay, so there are a lot of lifestyle things that can be done to optimize fertility. So one of those things is eating healthfully. A low glycemic index diet is ideal, so you want to keep your blood sugar levels consistent, which means small meals through day, protein-rich, green leafy, avoiding things that are heavy in sugar, will keep that euglycemic level, so that's one thing. The other thing is making sure that you're exercising. What I find is that fertility patients will often say, like, I stopped my exercise regimen. No, there are good studies that show that 30 minutes of aerobic exercise 5 days a week is ideal for conception. So you want to be active. That's one of those things. The other things is we don't know what amount of alcohol, you mentioned alcohol, we don't know what amount of alcohol is safe, so we say no alcohol, so you want to cut out alcohol as you're trying to conceive. We also know that extremes of BMI are not ideal for conceiving. Actually, it reduces the likelihood that you will conceive in a cycle. So that means too thin or too heavy is not where you want to be. So if you are trying to optimize yourself for fertility, you want to be between a BMI of 20 to 25, ideally. The caffeinated beverages you want to minimize as well. Caffeine is a vasoconstrictor. We're trying to optimize blood flow to uterus, optimize blood flow to ovaries. Also, I mentioned alcohol for men. So fertility is not all women. 30% of the time it's male factor issue. So smoking and alcohol, really bad for sperm. It makes sperm swim slower. It also, it's not as vital when we're looking at the parameters of sperm. We know that there's can be decrease in the amount of sperm and decrease in the movement with purpose of the sperm. We also know that smoking is bad for eggs. Yeah, and women don't necessarily realize that our ovaries are egg storage units, and you're damaging your storage unit by smoking, so cutting out smoking. So those are some lifestyle things that people can do when they're trying to conceive outside of ovulation induction agents.
Okay. We have another question from one of you, so keep those questions coming, and this is a great one. Someone is wondering if endometriosis can affect fertility and just how hard it is for a woman with that condition to get pregnant.
Okay, so yes, the answer is yes, endometriosis. And I should say what endometriosis is. Endometriosis means the inside lining of the uterus or endometrial glands and stroma that are not located where they should be in the uterus. And so it goes into the pelvis, and it can be located on the ovaries, in the back behind where the vagina and where the uterus is tethered into the pelvis. Sometimes it can cause damage to the tubes, so people can have tubal blockage. But we also know that egg quality is impacted by endometriosis as well. You can get big cysts on your ovaries and then have extreme pain with intercourse and pain with your periods.
And very heavy periods from what I
Not necessarily very heavy periods. So very heavy periods is more a sign of what's happening inside the uterus. So you might have a polyp or you might have a fibroid.
Okay.
But with endometriosis too, there are stages of it. There's stage 1, 2, 3, 4. Stages 3 and 4 are where there's a lot of alteration of the anatomy inside your pelvis, so it's much harder to conceive that way. And then if you're younger with endometriosis, you're less likely to have significant fertility issues because you've had less months of cycling in your lifetime. So people who are trying to conceive who've had long-standing endometriosis in their mid-30s have a much harder time than the even average 35-year-old who might have a hard time because we're considered of advanced maternal age at that age. So yes, the answer is endometriosis can impact your ability to conceive. If you are wanting to have an assessment of what the stage of your disease is and what impact it could potentially be having, I would recommend that you speak with your family doctor or your healthcare provider, your primary care provider, and then ask for a referral to a gynecologist, or if you really are concerned about fertility, to a fertility specialist so that your individual case can be assessed. Because most of the time women with endometriosis are managing pain first. They're not thinking about pregnancy all along. But I think it's important to consider pregnancy maybe even sooner than the average woman, just because for longer time of exposure to menstrual cycles with endometriosis can compound your fertility issue later on. So that's a very good question to raise. Yeah.
I just want to remind everyone by asking a question and by sharing your fertility journey in the comments, you're entering yourself to win an amazing prize from First Response. We've got these awesome First Response products that will help you get pregnant and be healthy when you're pregnant. And also there's a $100 Shoppers Drug Mart gift card in there. So pretty cool prize. Let's go to another question. Someone's wondering if someone is irregular, and this will resonate for you, Natalie, when should they be testing?
Right. So if you're irregular and you're still getting periods every 3 months, you should begin testing regardless on day 5. That's because it will establish your baseline. The issue is that you may exceed the 30 days of the tests that you have for a month. You might be taking 2 months worth of strips before you find something. So that's where it gets a little bit trickier. And also, the number one reason why women have irregular periods, the most common one, is actually PCOS as a diagnosis. And with PCOS, most women's baseline LH is higher. So often patients who actually do have PCOS will say, well, I've been testing and it told me every day was a fertile day. So you have to be mindful of the fact that certain conditions might make testing a little bit more difficult, and that's where you might require assistance of something. So if you bought 2 months worth of test strips and either it tells you every day is the day or you're never getting to the day, that's where I think it's time to access additional care.
I got tested early in my mid-20s, or I'd say actually early 20s.
Yeah.
I got tested just because I wanted to know, not that I was planning a family at that point. I just wanted to know.
Yeah.
And that's when I got my misdiagnosis. And it wasn't until I actually started trying to have a baby that I found out that they were wrong the whole time. But I felt more prepared for what was going to come in the future by testing before I was even thinking about having a family. And
that's smart, actually.
And I think just even knowing what's going on in your body as well,
Yeah.
I think that's very helpful.
It's really interesting that a lot of us have no idea really about our cycles and about when we ovulate, that there's a time of the month when we do. We never give it a moment's thought until
it's time.
It's time.
Yeah.
But these are our bodies.
I
It
have
only
exactly-
benefits us to learn about
I
these
have
things.
these conversations daily in the office where I tell people, then I said, there's an ovulation hormone. They're like, for real? Like, there's an ovulation hormone? I'm like, yeah. There's an ovulation hormone. You can check for it in your urine. We can check for it in your blood. The 2 days after you surge are the best days to have sex in the month. And sometimes when we see patients in, we monitor them for 1 month and they get pregnant, they're like, oh my God, I just didn't know, right?
Yes.
So knowledge is power. It's really important to talk about. I think you made a really good point also, that finding out what your fertility ability or your fertility potential is early on.
Ability.
I just
like
came up
that.
with that. Fertility ability?
that. Yeah.
Okay, we need to coin it.
Hashtag it.
Yeah. Put a pin in it. But yeah, your fertility ability, it's important to know what your ovarian reserve is like so that you can make an educated decision about, or an empowered decision about what you need to do if you need to do something.
Yeah.
So if you find out that your ovarian reserve is dwindling early, but having children is important, but you're building your career, maybe you'll decide to freeze eggs.
Right.
Or maybe even if you're really significantly low, you'll decide that you want to have a baby right away. Like, it allows people to make the decisions and start doing what they want to do. Maybe they won't want intervention. Maybe they'll want to go home and do conservative things to try and get pregnant. And often I do send people, go for 3 months and try, because I haven't found anything.
Right.
Right? And then I say, use the home tools that you can use. And if you're not pregnant in 3 months, then we'll regroup, right?
Thank you so much for all your questions. I know that they're coming in, and we have another one from you guys, so thanks. Does PID make it harder to get pregnant? So you will have to say what that is.
Yeah, so PID is pelvic inflammatory disease, and it is something that happens after there's been an infection in the pelvis. And when there's an infection in the pelvis, it can lead to like scarring and stickiness in the pelvis, which can affect the tubes. So when patients have PID, the tubes can be impacted, so we call that anatomical factor in fertility. And even though we treat it with antibiotics, the issue is when women have sexually transmitted infections, it is insidious because it hides in our pelvis, and we might have pain because we're used to having pain with our periods, and then kind of poo-poo it and not pay attention to it and not get treated with antibiotics, and then it kind of does the damage on the tubes. So if you do have a history of having a sexually transmitted infection that was treated later on or even treated early on, it's also important to have your tubes assessed, because there are tests that we can do to assess tubal patency or tubal openness.
Another question, and so this is for the people who have the luxury of worrying about girl versus boy. I mean, if you're not struggling with fertility, you can go on to thinking, well, how can I affect that? So this reader is wondering, is it true that depending on the time of your cycle and the time of intercourse, you can sway the odds one way or the other?
I've heard things. I'm interested to see.
There's a lot of urban myths
there
about
are
this.
A lot of urban myths.
Yeah.
Yeah, and I'm Jamaican, so I was told all kinds of stuff that actually didn't pan out.
No,
right?
not so much.
But we do know that the male, so the sexing or the gender is determined by the male gamete or the sperm. So the sperm is what brings X or Y. Female chromosomes are 46XX, and male is 46XY, right? So it comes from the sperm. It's the sperm's fault, just saying, because that's also one
that
we
can blame.
Exactly.
But the faster swimming sperm are male, right? So often when we'll say, well, if I have sex before I ovulate, which is what we do anyway, you do the surge and you say have sex for 2 days, because though the sperm is ready and waiting in the tube, so as soon as the eggs get out, the sperm can meet the egg, we're ready to go. Yep. But the faster swimming sperm are male. So there is some truth to it, but it's 50-50.
All right, so you can try to control these things, but at the end of the day...
People, I'm going to have sex all the time, right around, early.
All right, another question, keep them coming. Is it normal for you to ovulate early in your cycle with Femera?
No, not for me.
Right, so it depends.
Yeah.
So in women who are not ovulating, if you're taking Femera, it will make you seem like you're ovulating earlier because you weren't ovulating without it.
At all, exactly.
Does it make you can also, the way that you administer Femera, you can do a letrozole step-up protocol, which does seem to make women ovulate a little bit sooner, but that's based on the dose of the Femera that we give. But it's really individualized. There are some women that ovulate earlier and some women that ovulate bang on the 14th day, and some women that don't respond to it at all, so it varies.
Okay. Great question, especially given the legalization of cannabis in Canada. Someone is wondering if using cannabis can affect your ability to get pregnant, and I think we should answer this both from the woman using and the male using perspective.
So we have known forever that cannabis makes sperm slow.
Kind of makes sense, like
kind of what it does.
Yeah,
kind of what it does to the guy.
It
does to the
Tarantino.
I don't know if it's. I don't know if the sperm is like snacky.
I can't tell.
I can't tell, but it does make the sperm slow. So move with less purpose, and sometimes can affect count. What we are discovering is that cannabis also seems to affect egg quality, but we need to, there's some preliminary studies that we reviewed, and I actually had this question myself with the legalization of marijuana in Canada. So for the jury is still out in as much as exactly how much will impact to what amount, but there definitely is an effect of it. We see it when we do in vitro fertilization because patients are open. They say, well, yeah, I smoke once a week, I smoke 3 times a week. We do see diminishing egg quality with exposure to cannabis. So I tend to tell patients not to, but we will know the information, the detailed information over time, because now more and more people are going to be using it, so we'll have some objective data.
Yeah. I guess there's also that balance to think about when you're trying to get pregnant. If you're like, you suddenly cut out drinking, you cut out, if you do use cannabis, you cut out that, you change your lifestyle, and it can just feel like a lot. And if it's dragging on and on and on, you know, psychologically that can
great point.
That can take a toll.
So you asked me before what people can do to help themselves. One of the lifestyle things is mindfulness. So we are discovering that integrative medicine or wellness, things like acupuncture, changing how you eat, additional supplements that you take. There are certain supplements, including coenzyme Q10, that help in energy for the mitochondria. Mitochondria are like the batteries of every cell of our body. The eggs are the largest cell of the human body. Only women have them, just saying. So we want to make sure that we're energizing our batteries in our large cells that are going to be doing the multiplication, division of cells and growing into a baby. So those are additional things that can be done. So I have my patients, for example, often accessing acupuncture, meditation, massage therapy, and we offer that in our office too. And it's not just for our infertile patients, just women who are trying to conceive of busy lives, who are just trying to carve out some time for yourself too, because sometimes having all of the focus on getting pregnant can bring you down.
Was that a factor for you?
Absolutely.
Did you take that into consideration?
Yeah, I took acupuncture. I went for acupuncture. I took some time to actually get into mindfulness. That was the first time that I really got into it, because that exactly, I was just so stressed and so upset with, you know, I felt like everything that I was doing was not getting me pregnant, and no matter what I tried, no matter what I gave up, I felt at a loss. I felt like I felt like I couldn't be a woman, because, you know, this was the one thing that I should be able to do, and I couldn't do it. So that was really, really hard for me, and probably my husband as well, you know, when he's trying to support me. And so, you know, we made sure that even as a couple, we took time to just have fun and try not to think about it. And I know a lot of people go through that, and it can be hard when you see friends getting pregnant and you know, people talking about it, and even walking down the street and you're seeing pregnant women and suddenly you're just aware of it all. So I know I found that helped, that really taking that time for me and taking deep breaths, breathing, huge. I learned a lot about breath during that time, and you know, that helped me with everything, really.
Yeah, managing the experience.
Managing the anxiety. And I felt, you know, like you said, it's just living a healthier lifestyle, the exercise, the eating properly, just made me feel all around a better, healthier person, which I'm sure contributed to it.
Yeah.
And empowering women to do the things, some of the stuff you can't control.
Right.
So you can controlling the controllables is helpful.
Absolutely. So I feel like that's where ovulation predictor kits can come in too. That is, you know, rather than just leaving it to like, I guess my mucus is right. I guess I felt something. I guess looking at the date, it seems right. But at least this gives you a little bit of actual data to go with.
Yeah, absolutely.
I think for certain people that
analytical
kind of
people.
That's right. That's me. So that would have been a huge factor.
Yeah.
Okay, we have another question. This one's pretty specific, but I'm sure it's something you'll be able to address. So this person says, I have PCOS and had to use 3 rounds of Paragon and metformin and a bunch of other fertility medication to have my first child. We're currently trying for baby number 2. Exciting. Are there any other natural things that this person can try instead?
Right.
So isn't that where? So I tried metformin before we discovered that I didn't have PCOS.
Right.
But I think coenzyme Q10, is that where this would come in?
Well, coenzyme Q10 is one of those things that helps the mitochondria function the best possible, so those battery cells of the eggs. But in as much as that's a really specific to the person question, it's hard to be able to say, because sometimes we see that patients who required ovulation induction agents along with metformin, and metformin is an insulin sensitizing agent, and it's not for every woman with PCOS either. So some women with PCOS who have insulin resistance and who have resistance to the ovulation induction agents alone can benefit from the addition of metformin. But that said, after someone has had a baby, sometimes things get reset, and sometimes they don't. So after someone has required that degree of ovulation induction in order to have a child the first time, generally what we do is just a baseline assessment and checking where the person is after she is done breastfeeding, because that can also impede ovulation. So it can prevent you from ovulating because the hormone that allows milk to come down interferes with the hormones for ovulation. So it would be important to have a check-in for baseline, I think, because it sounds like your case is a little bit more complicated. But all of the basic things that we talked about for lifestyle, having weight in the ideal range, eating a low glycemic index diet, particularly for your circumstance if you were on metformin beforehand, having your supplements that you're taking at baseline, those are all the things that you can do ahead of time. And then if you are menstruating, because that's the thing with PCO, you have irregular cycles. If you see a pattern to your irregularity, like you have a period once every 45 days, the second half of the cycle, the luteal phase, is fixed at 14 days. So if you can count and see a regular pattern, if you have a 45-day cycle minus 14, that means that your ovulation day is day 36. Is that right, math? 45
sure.
Minus 14?
Yes, that's
it's
right.
36,
That is
so it
right.
would be day
It's
36 of the cycle. So
Yeah.
that would be the day that you should, around which you should be searching and having sex, right? So regularly irregular cycles, if you can count the 14 days back, those are your money days or whatever the big
And
days.
you can money days. You can use an app for things like that as well.
As well, that's a good point.
That you can track, that will also look at other symptoms. I used that with my first as well. So, the egg white thing, which I actually had a conversation with a bunch of girlfriends about. Egg whites, and even symptoms that may or may not, like headache or
breast tenderness. Or the twinge on one side or the other. That's actually called middle schmerz.
Right?
Really?
Yeah, the Germans get the best
the
names for these things. Middle schmerz.
Middle schmerz.
Middle pain.
I like that.
So someone is wondering how effective are period trackers. So I'm imagining that they mean it's maybe an app where you're keeping track of your cycles. So maybe they're thinking, can you just go by the dates and not use a test like this?
So period trackers work by creating an average of your cycle. So as I said, that what I was just explaining is really, if you have a consistent average, it's pretty good at determining where you are. The thing about the LH kits is they really do tell you when the surge happens, and we do know for a fact that your most fertile days are the 2 days after. So it's a little bit more specific. You can use them in conjunction, right? Like you can, and then you can actually show on your period tracker where you're knowing your surges usually happen. So I would use them in conjunction, kind of stack your deck.
Absolutely.
So let's say you are using an ovulation kit and you get an LH surge. Is it possible to have that surge but then not ovulate? Because I think people are probably like, it says I ovulated, but why aren't I didn't get pregnant. So it be?
It is possible. That's a possibility. So if you're seeing a no, and then yes, and you're having sex and it's not working, and you've done that consistently, say for 3 months, infertility is defined as a whole 12 months of that. But if you are a 35 plus, I wouldn't wait a whole 12 months. I would say wait 3 months, consistent trying, it's not happening. Start thinking about seeing someone to help you. But at the end of the day, using the kits and showing you that you have your LH surge, it's not an absolute that you've ovulated. We even see it in the office when we're actually following patients and we see the surge and we follow the follicles and we say, okay, it's time to go have sex, and they come back, we check, we call it an ovulation check. We check the progesterone, it hasn't gone up. So it's more exceptional than the rule.
Okay. Another question, keep them coming. This is great, guys. How soon is too soon to take a pregnancy test? We touched on this a little bit, but is there like a certain date, like you're wasting your money, or is there a certain time?
Yeah, I mean, if you're taking it 4 days after you've had intercourse. That's too soon.
It's just because those hormones will not
They're
have
not being
been
produced. I
created
mean, you
yet.
think of a microscopic egg and microscopic sperm getting together, okay, then hopping down the tube, and then it has to implant. So implantation happens somewhere between 3 to 7 days after fertilization. So if you're taking the test before it's implanted, you're not going to have the hormone in the bloodstream, or it won't be excreted in the urine. So you really do have to wait to get at least a week and a half from implantation to be able to get the test. But of course now it says 6 days sooner. So it's way better.
Yeah. Which is very exciting.
Oh yeah, this was not the case 10 years ago when I first started. And it is really, it's so hard to wait. And 6 days is a huge deal.
It's a huge deal. And then of course you want to ensure with you with 7 tests, lady, but you want to be certain, so then you can take a test 24 to 48 hours later to see. You can actually watch the progression. We have a lot of patients that are gestational surrogates, for example, that are carrying babies for other people, and they're so excited for their intended parents. They're to show them, oh, we got pregnant together. They'll start taking those tests early, and those ladies show you the progression. It's light, then darker, then really, really, really dark. So you can actually it empowers you that, okay, I know what's going on with my body.
You mentioned middle schmerz, that pain that you can get during ovulation. Is that common? And I'm also wondering if you ever felt that.
No, not that. No, I had absolutely no idea. I was just waiting for the doctor or the test, or actually both, to tell me that it was time to go.
Yeah.
I didn't.
And ironically, as a fertility specialist gynecologist chick,
Nothing for you either.
Dead.
No,
Didn't know.
no sign.
No sign. I watched for it.
Yeah.
Waited for it. Never. But it happened apparently. But I didn't feel it.
So is there any way to know how common that is? Like, is there a percentage of women who might get that little twinge?
That is a question that I can't tell you in as much as the percentage. But patients will tell me on a regular basis, and I'm actually in awe of these ladies. They're like, oh, I know exactly. I feel it. It happened on this side, and they're right. So some women do know.
And they even know what side.
They know what side, and then I have the objective data to say, oh, yeah, she's right. Like, it's
That's
surprising.
very cool.
Someone out there, thank you for your questions, is wondering how common it is for women to ovulate at a different time every month.
It is not that common in a woman who has a regular cycle, 28 to 32 days, to ovulate at different times. There generally is a pattern that establishes itself, even when we do what's called a diagnostic cycle and we watch someone just to see what her baseline is that makes her her. It's pretty reproducible.
Someone is letting us know that they actually had a miscarriage at 13 weeks. Been there, and I'm sorry for your loss. Does that affect the next time you try to get pregnant? Is there anything that this woman can do to try to prevent that next time? And also, the same person struggles with this because of low progesterone.
Low progesterone. So, thank you for sharing. I'm sorry. Miscarriage is a tricky one because it's very specific to the individual, and there's certain factors that have to be looked at kind of in a systematic way so that we know that it's not something that's a recurring thing and it's a sporadic genetic thing. So when we look at miscarriage, most often it's a chromosomal, unfortunate, poorly arranged, and not consistent or compatible with ongoing pregnancy. Genetics are the #1 reason for miscarriage, and they happen more as women age because the genetics of our eggs decrease in their quality because they've been on the shelf longer as we age. But sometimes there's something called recurrent miscarriage, which can be a result of something. So it can be an anatomical issue, it can be a chromosomal issue, it can be an endocrine, a hormonal issue, it can be an immune issue, it can be an infectious issue. So you really have to work through things systematically to ensure that it doesn't recur. But one of the more common reasons that we see associated with women in infertility and potentially miscarriage is having low progesterone. Progesterone comes from once you've ovulated, the egg comes out, the capsule that's left over becomes what's called a corpus luteum cyst, and that's where the progesterone comes from to support and organize the lining of the uterus for implantation to progress. And if you don't make enough progesterone, you can't necessarily maintain a pregnancy. And then after 10 weeks of pregnancy, it stops coming from that corpus luteum, and then it comes from the placenta. So generally, when women have a history of miscarriage, once they get to that 10 to 12 week mark, we get excited for them. But still, unfortunately, people can sometimes miscarry beyond that. So one of the things we do look at, when I said ovulation check, we do check the progesterone and where it's at, especially if we've used something like a hormone called HCG, so we can induce ovulation with HCG. We're getting a little more complicated, yeah. But so when you use it, you can destroy some of those theca lutein cells that make the progesterone, and then you want to supplement back progesterone. So it can be helpful to take additional progesterone, and sometimes the progesterone that we administer is vaginal, and then sometimes the progesterone that we administer is intramuscular. Sometimes it's a gel. We rarely tell people to take it by mouth because we metabolize it through our liver really quickly. So those are kind of the things that we can do to help support for miscarriage, but it's important for you, especially if it was around 13 weeks, to see someone just to make sure that it's not something that could be prevented from happening again. But the good news is when you have, well, the good news is, the silver lining is that even though you do have a miscarriage, you can go on to have a completely normal pregnancy thereafter. So you should be encouraged in that. Often I think women don't talk enough about how frequently miscarriages happen and how people do manage to conceive thereafter and go on to have children. So I don't want women to get dissuaded or entirely discouraged when they have a miscarriage, because I don't think we talk about it enough. It happens to everyone. Michelle Obama talked about her miscarriage experience. So it happens frequently. Don't lose hope or faith. And if you are concerned, do consult with a physician, because the reasons behind it are very specific.
Yeah. Thank you for all your questions. Keep sharing your questions and your pregnancy and fertility journeys in the comments, because there will be a prize for one of you that we'll be drawing for tomorrow. But we do have another question for you guys. So this person is wondering about the effect of caffeine on fertility. You mentioned it. You mentioned that to prepare your body, maybe you want to dial back the caffeine, but to quit completely is difficult, especially if you already have some small children at home. So what does the science say, both for women who are struggling with fertility and just for women who are coming out?
So this is one that I get a lot, and women feel like they have to cold turkey, no caffeine. So what we do know about caffeine is that caffeine is a vasoconstrictor. So when you're trying to conceive, you want blood flow to go to all of the organs of your body, including particularly the ovaries and the uterus. And so drinking a lot of caffeine can impact vasculature, can impact blood flow. And as you're trying to grow a placenta, you want there to be as much opportunity for good exchange in the maternal-fetal interface. So 1 cup of coffee daily is fine.
And is that for men and women?
Or the men,
good
yeah,
question.
sperm. Yeah. So testicles are sperm production factories. Generally speaking, I mean, sometimes there can be a blockage, or sometimes it can be a production issue. That aside, if sperm is okay, caffeine doesn't impact. But it's nice to support your partner, so stop the caffeine too. Just
I like
public
that.
service
I
announcement.
like
I'm like,
that,
don't drink coffee in the face of someone who can't. But 1 cup of coffee daily, 40 milligrams actually, so is fine.
So we are going to wrap this up. We're going to end this Facebook Live now, unfortunately. We are actually going to announce our winner. I had mentioned earlier that we would let y'all know tomorrow, but in fact, we're gonna do that right now. So the winner of our prize, and let me just tell you what it is again, it's a bunch of first response products that will help you in your fertility and pregnancy journey, as well as a $100 Shoppers Drug Mart gift card. Who can't use that? And the winner is, drumroll, Crystal Bruce. Bunts. Crystal Bunts. So thank you so much, Crystal. Woo, you got some good stuff coming your way. If it hasn't happened already, someone will get in touch with you. So thank you so much for being here, Dr. Marjorie Dixon and Natalie Preddie. You guys have really added a lot to this today and given our viewers a lot of excellent information. Thanks again to First Response, who made this Facebook Live possible, and thank y'all for, like I'm from the South.
I like it.
It'll be my new thing. Yeah. Thank you so much for joining in with us today, and we look forward to reading all your pregnancy and fertility journeys in the comments, and best of luck. Thank you.